In this video, we are going to see about the small intestine meridian. Before that, I welcome you all to the Aku world. Small intestine channel comes under fire element. As we know, there are two types of fire element. One is major fire element and the other one is minor fire element. So small intestine channel comes under major fire element. In TCM, small intestine combines with heart. Before starting with the points, let us quickly discuss about the functions of small intestine. Its main function is to break down the food and to absorb the nutrients for the body. It helps in eliminating the waste from the body. It also stops the harmful bacteria entering into the body. Let us start with the points now. Small intestine is a young meridian which has 19 points. It starts from the small finger and ends on the face around ear. SI1. It is the middle point of small intestine meridian. It is located 0.1 chun posterior to the corner of the nail bed on the ulnar side of the little finger. It helps to regain the lost consciousness. It also reduces chill fever and malaria. It cures tinnitus and deafness. It is the important point for stiffness of the body. It also benefits breast. SI2. It is the water point of small intestine meridian. When a loose fist is made, the point is formed on the ulnar side of the hand distal to the fifth metacarpophalangeal joint at the junction of red and white skin. It is a good point for mumps. It reduces wrist pain, numbness, and itching of the finger. It also drains heat from the body. SI3. This is the out point of small intestine meridian. When a loose fist is made, it is located in the depression proximal to the head of the fifth metacarpal bone at the junction of red and white skin. This point helps to produce lactogen. It also helps to get rid of stiff neck, shoulder pain, jaundice, deafness, tinnitus, and it also clears the heat. It also cures the disorders related to cervical pain. SI4. It is located on the ulnar aspect of the palm in the depression between the fifth metacarpal bone and hamate bone at the junction of red and white skin. It is the one source point of the small intestine meridian. It is useful in treating jaundice and diabetes. It reduces pain in the lumbar region and leg. It also reduces wrist pain and it also cures weakness of hands. SI5. It is the out point of small intestine meridian. It is located near the ulnar end of the transverse crease on the dorsal side of the hand in the depression between the styloid process of the ulna and the tracheal bone. It reduces the stiffness of tongue. It also reduces the swelling. It releases the locked jaw. It also cures eye pain, shoulder pain, and it clears heat from the body. SI6. It is located on the dorsal side of the breast in the bony cleft on the radial side of the styloid process of the ulna. It is the Z cleft point of small intestine meridian. It helps to treat stiff neck, cervical spondylosis, It also benefits the eye, it reduces the pain, it benefits the shoulder and arm. It is the important distal point for pain. SI7. It is located 5 chun above SI5. It is the loop connecting point of small intestine meridian. It reduces shivering fever and lumbar pain. SI8. It is the earth point of small intestine meridian. It is also the sedative point of small intestine meridian. It is located between the olecranon process of the ulna and the medial epicondyle of the humerus, found with the elbow flexed. It cures toothache, tooth decay, throat pain and swelling of throat. It also helps to get rid of yellow eyes and malaria. SI9. When the arm is abducted, it is located 1 cun above the posterior end of the axillary fold, posterior and inferior to the shoulder joint. It cures shoulder pain, frozen shoulder, paralysis, tinnitus, and deafness. SI10. When the arm is abducted, it falls directly above SI9 in a depression inferior to the scapular spine. This point connects small intestine meridian and urinary bladder meridian. It reduces chill fever, swelling of shoulder, and shoulder pain. This point works perfectly when a person is not able to raise his hand. SI11. It falls in the depression of the infrascapular fossa, one-third the distance between the lower border of scapular spine and the inferior angle of the scapula, approx level with T4 spinous process. It reduces shoulder pain, breast pain, and swelling of breast. This is a lactation point. It benefits the breast. It also alleviates pain. SI12. It is located above SI11 in the center of the suprascapular fossa in the depression when arm is lifted. This is the meeting point of 4 channels: small intestine, large intestine, triple warmer, and gallbladder. This point is very beneficial when a person is not able to turn the neck. It also treats cough and phalgem. It also benefits the shoulder and scapula. SI13. It is located on the medial extremity of suprascapular fossa above midway between SI10 and the spinous process of T2. It helps to get rid of scapular pain. It also relaxes muscles and tendons. SI14. It is located 3 chun lateral to the lower border of spinous process of T1. It reduces upper back pain, shoulder pain, and pain in the scapula. SI15. It is located 2 chun lateral from the posterior midline below the spinous process of C7. It reduces the dimness of vision and also treats cough. It also helps to get rid of blood while spitting. SI16. It is located on the lateral side of the neck, posterior to SCM, posterior and superior to LI18, level with the Adam's apple. It treats throat infection, throat pain, and goiter. SI17. It is located posterior to the angle of mandible in a depression on the anterior border of SCM. This is the dangerous point. It cures thyroid, tonsillitis, goiter. This point is more beneficial when a person is having buck teeth. It also treats wheezing, asthma, tinnitus, deafness. This is called the heaven point. It also benefits the ear and throat. SI18. It is located directly below the outer canthus of the eyes in the depression of the lower border of the zygoma contraindicated to the moxibustion. It is the anesthetic point. It deviates the pain from the body. It treats the twitching of eyes. It reduces swelling and clears heat from the body. It also alleviates pain from the body. It is the important local point for disorders of face. SI19. It is located anterior to the tragus and posterior to the condyloid process of the mandible in the depression formed when the mouth is opened. It is helpful in treating deafness, tinnitus, epilepsy, and toothache. It also helps in regaining the lost voice. It also treats all kind of ear disorders.